12 lead placement with an ECG. So BSI, scene safety, using standardized precautions. I'm going to come up to my patient, get my general impression, noting maybe in the position that they're sitting in, whether they're grabbing their stomach or chest or leaning forward, maybe in the recovery position. So I'm going to come up to my patient. Alrighty, sir, ma'am, what seems to be wrong? What seems to be the problem? I may assess their work of breathing. While doing so, I'm going to place a blood pressure cuff and SpO2 before I even get started, just to see their baseline vital signs. I may even place a capnography, just to see their capnographic waveform. So now I'm going to come into the skill. I'm going to tell the patient what I'm going to be doing. So, sir, ma'am, I'm going to be placing stickers along your arms and along your chest. If they're female, then I'll maybe say their left breast. So allowing them to know that this is the proper sequence of what we're needing to do. So coming up, I'm going to have my appropriate limb leads. So unfortunately, my patient does not have any arms or legs, but I will note the correct anatomical position, noting that this is LA, so it stands for left arm. So I'm going to place this lead on the patient's left arm, this lead on the patient's right arm, and then the left leg and right leg. Okay, so now I'm going to come with the 12 lead cables. Okay, so sir, ma'am, I'm just going to place these stickers. All this is going to do is just allow us to see a picture of your heart, to note any abnormalities or any good signs. So I'm going to go ahead and get V1, okay? So V1 is going to be placed right of the sternum at the 4th intercostal space, okay? So I'm going to go right of the sternum, 4th intercostal space, 1, 2, 3, 4. Now, keeping my landmark with my finger, placing V1 on the patient's chest. Now I'm going to come along with V2, which is the yellow one. Okay, I'm going to do the exact opposite. So I'm going to go to the left side, still the patient's left, to the 4th intercostal space, 1, 2, 3, 4. Keeping my finger on the location, placing V2. Alrighty, so now I'm going to jump to V4. Alrighty, so I'm going to go to V4. Now V4 will be placed in the mid-clavicular line of the 5th intercostal space. So I'm going to find the mid-clavicular, which is just under the nipple. So I'm going to go 1, 2, 3, 4, 5 at the 5th intercostal space. Now I'm going to jump back to the 3rd. So V3 will be placed just between V2 and V4. Okay, so I've got my correct position for placement. Now I'm going to place V3 just between V2 and V4. So now I'm going to go ahead and jump to V5. Now this one I'm going to place anterior axillary. So it's going to be the same level as V4. So remember, V4 is at the 5th intercostal space. So anterior axillary. So I'm going to come along, find the 5th intercostal space. Now I'm going to place V5 along the patient. Now V6 is mid-axillary. So mid-axillary means just below the patient's armpit, still along the same side as V4, which is the 5th intercostal space. So I'm going to find mid-axillary. I'm going to go down 5 intercostal spaces. I'm going to place V6 on the patient. Now I'm going to connect my V1 through 6 to my limb leads. Okay. If I haven't already done so, I'm going to ask the patient their age and their sex. Not what they identify as, but what they were born as. So now I'm going to tell the patient to remain still. Maybe they need to lay back, maybe they need to sit up, whatever allows them to be the most comfortable and allow them to remain as still as possible. So what I'm going to do now is I'm going to come over to my monitor. I'm going to press 12 lead, and then it's going to prompt me to ask the patient their age. I'm going to dial in their age, so maybe 43, etc. So I'll put in 43 using the dial, and then I'll ask me their sex. So maybe this patient is male or female. I'll select the correct sex. Automatically, it's going to start evaluating their heart rate, their blood pressure, and then all the views of V1 through 6, along with leads, AVL, AVF, AVR, just to look to the side, going towards the feet, and then inferior. So it's going to print me out a 6-second strip. Once again, before the strip prints, I'm going to ask the patient to remain as still as possible, breathing fluidly, breathing in through the nose and out through the mouth. So it's printing me my strip. Now I'm going to read my strip. I'm going to look at my limb leads, noting no abnormalities, working my way to AVR, making sure that all the leads are in the proper anatomical location. I'm then going to work my way down to AVL and AVF. Now I'm going to go see, looking at starting at lead 1, working my way through lead 1 to lead 6, or V1 through V6, sorry. Now I'm just noting any abnormalities, maybe increased heart rate, so rate, rhythm, just the type of, maybe the type of rhythm that it's in, so maybe AFib, VFib, SVT, just looking at tachycardia, maybe increased heart rate, maybe I have depression that could lead to or be a cause of myocardial infarction that we can't see. Maybe the patient's nauseated. Also, I'm going to look at all of my numbers along the top, such as my QTC, noting that if it's the correct range for a male and the correct range for a female. So with doing so, just for this instance, I'm going to tell the patient whether it's wrong or whether it's something that we're concerned with or something that we think that they need to correct or go ask their primary care physician. When doing so, or if it is such as depression or anything such as that, we will then transport the patient to the appropriate facility while doing so. With that being said, if they are a critical patient, we will then select the monitor to take a 12 lead for anywhere from 5 to 10 minutes. More than likely we will do 5 minutes just to increase the period of 12 leads. Still noting and telling the patient that they need to remain still and calm and breathe in and out correctly. And then that is 12 lead ECG placement.